Hospitals are important social institutions where clear communication and positive interactions between staff and patients is vital. Given the nature of events that occur within hospital environments, poor communication can lead to disappointment, upset, and even cause issues with duty of care. When a patient is diagnosed with a certain illness, sometimes it is not made clear to them that they could die from this illness. Although sometimes this may be because they themselves are in denial, it is often because nobody has told them. The conversation between doctor, patient, and immediate family about the true possibility of death is a difficult yet important conversation that needs to be communicated. Doctors need to show understanding, recognizing the delicacy of the interaction, yet deliver medical information in a clear, concise, and unmistakable manner. In this video presentation, one such interaction is analyzed using discourse analysis. The text chosen for analysis is a YouTube video. I selected a video source given the intimate nature of the interaction. I thought it would be important to observe the social contextualization cues and behaviors that visually occur through body language and facial expression. The video that I selected provides a specialist perspective of how to approach telling a patient and their immediate family that they are coming to the end of their life. Discourse analysis is the clearest and most appropriate framework for analysing communication within a social context, as it serves as an effective way of exploring text. The video source was created by Frontline in 2015 as part of a short documentary called Being Mortal, exploring the ideas of aging, death, and the significance of the last days of life. This video raises awareness about the type of real-life conversation that needs to occur sometime before a patient is going to die. Everyone at some point experiences death, and many of us as family members will at some point have a loved one in our life who is approaching the end of their life. Medical professionals must use their knowledge and translate it in a clear and concise manner to avoid miscommunication of any kind. Similarly, patients have different knowledge schemas, unaware of specific medical proceedings. Within the text, the interaction begins with the wife talking to an emergency surgeon. However, with the clash of knowledge schemas, there begins a breakdown in communication. Audrey's lack of knowledge is evident as she believes that her husband does not need hospice care. Conversation repair allows speakers to deal with various types of problems within the interaction's advancement. The specialist greets Audrey and asks how she is doing. She responds immediately. Let's not even ask questions like that. The specialist realizes she has made the mistake of asking an insensitive question. Conversation repair occurs when the specialist squeezes Audrey's hand and repeats, I know, to ensure Audrey that she understands how she feels. As a genre, medical or clinical discussions are frequently a balance between questions and answers organized by a controlled set of procedural steps. This allows turn-taking to be effortless and undisruptive. Miscommunication is often caused by a lack of balance in turn-taking, as one participant's message is not clearly communicated. The conversation is led by the specialist through footing the procedural frame to communicate some clear-cut facts in an empathetic manner. Turn-taking is present throughout the dialogue between Audrey and the specialist, with agreement tokens such as, yeah, I know. In order to deepen and progress through the conversation's interactive frames, a certain level of trust is required. Trust and relationships develop with time and quality communication, according to Lewicki, 2006. However, given the pressing timeliness of the discussion, the specialist must do her best to develop a supportive and understanding relationship in a timely manner. This is achieved through affirmative body language, eye contact, and supportive reaching out. By maintaining positive body language and eye contact, the specialist reassures a safer and positive social interaction. The specialist sits alongside Audrey, giving her full eye contact and her attention. This creates a comfortable and safe environment in which the specialist and Audrey can discuss future possibilities through effective communication. It is evident that the specialist has expertise in palliative care and end-of-life discussions, given how well she signals and balances frames between the objective frame with the subjective emotional frame. The specialist hugs Audrey when she realizes the reality of her husband's future. These effective contextualization cues help to maintain the balance between the socio-emotional interactive frame and the procedural proceedings frame. This text offers medical professions, especially those involved with palliative care, an effective example of how one may approach delivering a realistic conversation about a patient's future in a caring and compassionate way. It highlights the necessity for healthcare specialists to deliver serious news in a clear, concise, yet understanding manner to achieve good communication and avoid miscommunication. Insights into how to best approach important discussions regarding the realities of illness are provided throughout the text, summarized through multiple conversational techniques. Equal turn taking allows healthcare professionals to direct the flow of conversation, yet allows others to contribute and feel integrated in the process. Positive adjacency pairs create empathetic register and a safe, understanding environment that balances the interactive frames between the procedural, clinical, and socio-emotional. Positive body language and showing both patients and family members understanding and kindness will allow positive communication to occur.